A push to expand health coverage for low-income pregnant women in Utah is not moving forward.
Yeah, lawmakers voted down that proposal, even as doctors and child advocates pleaded with them to do something. News specialist Daniel Woodruff joined us live right now. Daniel, where does the issue go from here?
Well, that's really the question, Mike and Deanie, because the Republican who's sponsoring this proposal says he will keep fighting for it, but he's running into some here on Capitol Hill who say that the state just can't afford it.
I never wore a doctor's garb.
Bill Cosgrove is a retired pediatrician. He's treated thousands of patients over more than 30 years.
Healthcare is really expensive. It prices out a lot of people.
Cosgrove advocated for a proposal on Utah's Capitol Hill to expand Medicaid to cover more pregnant women living in poverty.
It would have allowed more women to access health care.
But the House Business and Labor Committee rejected it, a disappointment to the bill's Republican sponsor, Representative Ray Ward.
I understand that we cannot provide every bit of health care to every person, and I don't think we should try to do that. But if I think, what things do I think we should provide out there? Coverage in pregnancy is on my list.
Ward argued expanding Medicaid would use existing money, costing taxpayers basically nothing new. But fellow Republican lawmaker Norm Thurston disagreed.
I don't think this is a great year for expanding Medicaid. We don't have a lot of new money.
Thurston says women can already access health plans through their employers or through the Affordable Care Act.
We have to accept responsibility for people who are already being paid through their work or through the federal program. And it just is a super expensive way of doing policy.
But Cosgrove believes that's short-sighted.
We can invest a few dollars when they're young, or we can hoard that money and hope and pretend that they're going to turn out well and then build a bigger prison in 20 years.
Now, there was another part of this bill that would have continued funding from hospitals for an earlier expansion of Medicaid here in Utah. The bill sponsor told me he really hopes to come back at a future meeting here on Capitol Hill and get that part of it passed at least before the session ends in less than a month. At the Capitol, live, Daniel Woodruff, KSL 5 News.
Yeah, we'll continue to follow and see if that happens. Daniel, thank you.